Hi, I'm Dr. Onikepe Adegbola, founder of Casa de Sante, the virtual IBS clinic. So today I'm going to be talking about bloating, which is a common problem we see in people with IBS. So we know that diets have inconsistently showed improvements in many functional gut disorders such as IBS. And today we might get some insights into why this happens. So what is bloating? When someone says they're bloated, it can mean a lot of different things to different people. It could be a sensation of bloating in the stomach, or it could be visible distension of the stomach. The word bloating is also used by some people to refer to other sensations such as early fullness, nausea, constipation, belching, or gas. So when you're bloated and you want to find out why, you need to start thinking about what sort of bloating you have by looking at the relationship between when your bloating symptoms start and when you eat. It's very common for patients and also for healthy people to experience bloating after meals. So what we're talking about on this slide is someone who I would call an upper bloater. That's somebody whose bloating starts during or about 30 minutes after they eat. An upper bloater typically has symptoms such as epigastric discomfort, which is discomfort around the stomach area, fullness, and nausea. Possible causes of being an upper bloater are dyspepsia, obstruction of the gastric outlet, peptic ulcer disease, and infection with H. pylori. Now, you can contrast what we just said about an upper bloater with what I would call a middle bloater. A middle bloater is someone who gets symptoms more than 30 minutes after they eat. The key symptoms for middle bloaters are bloating, gas, and abdominal pain. Possible causes of middle bloating includes IBS, celiac disease, malabsorption, other dietary factors, and SIBO. Symptoms for middle bloaters could go on for hours after they're eating, and this is the traditional type of abdominal distension, the sensation of bloating in the abdomen, gas, and abdominal pain that we see in patients who complain of bloating. So finally, we're going to talk about the lower bloater. Many patients with constipation also report bloating, and the timing of this bloating is often unrelated to meals. And these are who we call lower bloaters. The key symptoms include head sores, gas, and difficulty when they use the toilet. Causes of being a lower bloater include constipation, IBS, specifically IBS-C, and pelvic floor dysfunction. So overall, we can see that thinking about the timing and relationship of bloating with food could be important. In future talks, I'm going to talk about the different types of bloating and the symptoms with each different type of bloating, how we can treat and characterize different types of bloating. So please join us to learn more about bloating. And if you have any questions on IBS in general or bloating specifically, feel free to reach out to us at casadesante.com. Our GI clinicians, dietitians, and health coaches are all trained in IBS and the low FODMAP diet. They would be happy to answer any questions you may have. Thank you, and feel free to reach out to us again with any questions that you have at casadesante.com. Take care.